Good evening, and welcome to another Facebook Live here on blackdoctor.org. I am Ellis Dean, the Director of Digital Programming and Production at blackdoctor.org, and I'm really excited about this program, right? Because we know it's January, in the beginning of the year. We make all these promises to ourselves. Some of them we keep. I'm not going to say we all break all our resolutions, but statistically speaking, 60% of people don't keep their resolutions through the end of January. But be that as it may, it is January. So we make a lot of resolutions. But January also has a couple of awareness months that kind of get lost in the pantheon of when we're talking about all the resolutions and getting started on that fresh new year. One of those things being Glaucoma Awareness Month. Yes, January is Glaucoma Awareness Month, and glaucoma, many of you know, disproportionately impacts our community, and so that's why we're here. And we've got two fantastic. Y'all just wait till I tell you about who these two people are. You'll be like, okay, we got some serious heavy hitters here to talk about glaucoma, break it down for you, tell you what it is, and then we're also going to give you some solutions, tips, techniques on what you should do if you're ever faced with getting glaucoma. So, first off, I'm going to introduce our guests. Like I said, they're just fantastic. So, first up, we have Dr. Nanita Brown, as you can see up there on the screen. She earned her Bachelor of Science degree in mathematics at Spelman College, in Atlanta. Dr. Brown earned a Bachelor of Science degree in electrical engineering. So not only did she get the math degree from Spelman, she went across 75 and got that Bachelor of Science degree in electrical engineering at Georgia Tech. But that wasn't enough. She didn't stop there. She got her medical doctorate degree from Duke University. And while at Duke, she completed a PhD in biomedical engineering. So let that sink in right now. So she got a math degree from Spelman, an EE degree from Georgia Tech, MD from Duke, and then while she was at Duke, I'll just go ahead and get this PhD as well. And then not only did she do that, she completed her internship at Santa Clara Valley Medical Center in the county hospital affiliate of Stanford University. Yep, you guessed it. And then she completed a residency in ophthalmology at Howard University. So she's done it all. Like I can keep going on this long thing, but just let you know you're in good hands today with Dr. Brown. Welcome, Dr. Brown. How are you?
Great, thank you. I'm doing real well.
And not to be outdone, we have Dr. Benjio Edgehill. He is chair of the ophthalmology section at the National Medical Association from 2018 to 2022. He's a Brooklyn native. He earned his Bachelor of Science degree in biology from the University of North Carolina, Chapel Hill, where he received the prestigious Moorhead Award Scholarship. He attended Duke University School of Medicine, receiving the Dean Scholarship, the Nathan Award, and the Charles Johnson Award. He also earned the RVO NEI Travel Fellowship Award and Research to Prevent Blindness Fellowship Grant. His formal ophthalmology training was done at SUNY downstate in Brooklyn. As a resident, he entered the RAB Venable competition and took first place in 2006 for his research on ROP. He returned to the Duke Eye Center to complete his glaucoma and anterior segment fellowship under the chairmanship of David Epstein, MD. He has been practicing in Staten Island for the past 15 years and was the only glaucoma fellowship trained ophthalmologist on the island for 12 years straight. Welcome to you, Dr. Edgehill.
Thank you very much. I appreciate the kind words, but I think you should introduce me first because Nanita is so much more. her introduction is so much more impressive than mine, but she's awesome. And currently, Dr. Fasika Wareta, who's one of your previous guests, is the NMA Ophthalmology Section Chair.
Okay, all right. So that has changed, but you're still here. You've done it before, so you are fantastic. So
thank you very much.
I'm going to open up with just the easiest question. So we'll start with Dr. Brown, as you said, just to start with Dr. Brown. What is glaucoma?
So glaucoma is a disease of the eye where you start to lose nerve tissue. It's associated with high pressure in the eye. And over time, people start to lose their peripheral vision. So it's a blinding disease that affects the nerve, which is the cable in the back of your eye that goes to the
Yeah, one of the ways that I try to explain it to some of my patients is if you have a phone and the phone line is connected to the receiver, the more of that wire that gets damaged, the fuzzier the sound is. So even
Okay.
though it's not a direct correlation with vision, they can understand that a damaged wire will give you fewer signals and fewer information. And when that wire is completely damaged, you're blind.
So maybe another example would be like a water hose. And if you start to bend that water hose, the water's flowing through, and the more you start to bend it, the less water comes through. That
Yeah.
is that is another kind of example where you could, and then if it gets all the way bent and pinched off, it stops, and that's when the vision is completely interrupted. So okay,
Yeah. And one of the amazing things about glaucoma is you can lose more than 50% of the nerve and still have no definite vision loss or visual field loss. So the reality is a ton of people in America have glaucoma and half of them don't even know they have it.
okay. Well, that was my next question, Dr. Edgehill. So you can follow up with that. How do you know if you have glaucoma?
Well, really, in a lot of cases, if you know you have glaucoma from symptoms, you're late in the game, which is very
Mhm.
dangerous. So we always recommend people in certain categories start getting screened early.
Okay.
African Americans have a higher risk, Hispanics, Latinx have a higher risk. People with family history have a 6 to 8 times the risk, especially if there's a sibling. 1 in 10 of the siblings will have glaucoma as well. And I know Dr. Brown can agree. A lot of times when you hear that somebody has glaucoma, at least one or more of their siblings also have it, whether they know it or not. They definitely need to be checked. First degree relatives, immediate family members, you're doing a disservice by not sharing your diagnosis of glaucoma with other family members, because it's essential for these people to get screened and hopefully get treated early if they do have it. People who have eye injuries, I know that was another topic you've had in the past. Eye injuries, which is very interesting because you can have an injury as a child and glaucoma may not show up from that injury until you're an adult. Um, Nobody really understands why it could take so long. Sometimes it happens immediately, but sometimes it can happen decades later. People who use a lot of steroids, and it doesn't have to just be steroid eye drops. It can be steroid cream, steroid nasal spray, steroids by mouth, steroid injections. All of these put people at a greater risk of developing glaucoma. But bottom line, once you hit 40, you should start getting your eyes checked, and from that baseline exam. And when I say, and I'm sure Dr. Brown has more to add to this, but when I say get your eyes checked, I don't mean just get them checked for glasses. You need a full dilated exam where your optic nerve is evaluated and possibly photographed.
Okay.
You have anything to add, Dr. Brown?
No, I think that's a great summary of where we start with glaucoma. I think the hardest part is that you don't know that you have it. It's just like high blood pressure. A lot of people don't realize that they have it because they don't have access to care. And being able to diagnose it early, we can treat it.
Can you imagine that? One of the statistics shows that about 3 million people in America have glaucoma, and half of them don't know they have it. So
Wow.
that should give you an idea of how prevalent it is.
Okay, so help me with those risk factors again. The people that are in the high risk group. So you said African Americans,
Caribbean Americans,
Latinx, Hispanic Americans, people with a family history, particularly that first generation family history of glaucoma. Am I missing something else?
Trauma history,
Trauma and steroid. That's right.
steroid
Trauma.
use history. Yeah. And, you know, there are different types of glaucoma, but these are the major risk factors for glaucoma.
And your risks go up as you age.
Yes.
So the problem is some people may get exams when they're younger and think that they're okay. Especially people who are nearsighted. If you can't function without your glasses, you're already getting exams when you're younger, but they may stop getting exams as they get older and they can develop glaucoma. So if you have severe nearsighted myopia, you can develop glaucoma later as you get older.
And anything that has to do with the vascular system, like diabetes, high blood pressure, even thyroid eye disease is associated with glaucoma as well.
So that's a good point, because I think sometimes as lay people, we tend to look at conditions in different buckets, right? The eye health is separate from heart health, and heart health is separate from lung health, but they're really all interconnected, because we did a series with Joseph Coney, one of your colleagues there, and we talked about diabetic retinopathy, and he always would say, "Hey, look, as an ophthalmologist, if I do an eye exam, I can see everything that you've been doing, whether it's drug use, if you got hypertension, if you got diabetes, even if you have informed diabetes, he can see it coming down the pipe just because of that eye exam." And then really, that was a fascinating understanding of how interconnected all of these systems are. So we were saying you've got, hypertension, that vascular illness could really have an impact and exacerbate potential glaucoma situation.
Yeah, the eye is really a window into what's going on in the body. So if you have any kind of chronic disease, sometimes it will show up in the eye first. So
And it's one of the, sorry.
No, I said these eye exams are extremely important as you get older.
Yeah, it's one of the only places where you could see for yourself the ends of vessels, where a vessel actually ends. And if you really magnify up, you can actually see blood cells flowing through these vessels at times, or the vessel pulsating, which it's one of the only places in the body where you can visualize these things. So it's amazing. And if you really think about it, we're very visual creatures. Almost 50% of the brain is dedicated to visual processing. So that just shows you how important vision is to us as a population.
Well, how much percentage of the brain is dedicated to visual processing?
Almost 50% of the brain is dedicated to visual processing and vision.
Wow. Okay. So, and we've talked about like the loss of vision and the impact it could potentially have on your social and occupational functioning, on your mental health, on your extended family. All of those things, caregivers have to come into play. So really, we have to protect our vision like a child, right? We got to make sure it's taken care of. It's got all its checkups and everything going.
Yeah.
So Dr. Brown, I know we talked about family history, and that is important in other conditions. Why is it important with glaucoma?
Well, we find that the drainage system of your eye, there are some different proteins and growth factors that kind of go along with different families. So they've done a lot of genetic research, and they find that certain pathology kind of repeats itself. So, for example, I'll say to my patients, we measure the thickness of your eye. So that thickness can tell us a risk factor for your glaucoma progression. So say the eye is more like a basketball versus a balloon. And if I increase the pressure in a basketball, it keeps its shape. It doesn't get damaged. But if you have a thin, like a balloon shaped eye, then you're more likely to get damage from that increase in pressure. So we measure the thickness of the cornea, and we can correlate that in families. And that's one of the reasons that people are at higher risk for glaucoma. So these things are passed down generation to generation. And I think historically, they probably had some type of protective mechanism, just like sickle cell disease for malaria. There was some kind of way that people were able to keep their vision and to do better if they had this genetic trait. But now with people aging, it totally is playing into them developing glaucoma.
Yeah, we're living so much longer than we used to. At one point we weren't even living past 40. So now that people are living well into their 90s and living their best life, 90s is a new 70, right? These diseases get a chance to manifest all the way to the end stage, and that's when things go bad.
Well, if you're just joining us, we are talking to Dr. Brown and Dr. Edgehill for Glaucoma Awareness Month, and we're talking about glaucoma. So if you just joined us, you already missed some big stuff. So you got to go back and watch it, but stay with us because we got some more stuff coming for you this evening. We've already talked about what the risk factors are. Let's stay on that risk factors for a moment here. So how do we minimize our risk factors? So if mama got it, right? So I say, so if you got glaucoma, call your mama and say thank you, or however you want to say, or your father, and just say, hey, look, you gave me glaucoma. But how do we minimize our risk factors for glaucoma?
So I would say, we start with things that we know are risk factors. So decreasing exposure to steroids, making sure if you play any kind of contact sports that you wear some type of eye protection, making sure that, if you do have diabetes, that it's under control. If you do have hypertension, that it's under control. You're exercising, you're sleeping, you're staying hydrated. I tell my patients the basics of your health, your general health is going to help your eyes. But there are not a lot of things that we can do to stop glaucoma besides lowering the eye pressure. Okay. And trying to treat it. And again, early diagnosis is essential to making sure that you don't go blind.
Yeah, I agree 100%. Early diagnosis is the key. This is blackdoctor.org. Let's be honest. African Americans, Caribbean Americans are going to suffer from this condition more than any other population. We're going to get it earlier than any other population. And if we get it and it's not diagnosed early, it's going to cause more morbidity in our population. We're going to go blind from it. They've done studies in other countries like Barbados, Caribbean countries, where people just had such an aggressive form that even with some of the treatments being started at a moderate stage, people still went blind. So our goal is to get people screened as early as possible, because the great news about glaucoma, and the reason why Dr. Brown and I are so passionate about it, is because if it is caught early, we can prevent it from making you blind in most cases. I personally have a family history of glaucoma, and the progression is one of progress, in a sense, where I say my great-grandmother went blind from glaucoma. That's what led me into it. By the time my grandparents were being treated with glaucoma, I was in medical school and I was able to help them with the treatment. They never went blind from it. My mom, I treated with a laser and she doesn't even have to use drops. And I know she's not going to go blind from it. My father neither. So, every generation, it should get better and better if you tell each other what kind of conditions you're suffering with and to get screened earlier.
Okay, so you brought up a point, and we're talking about like race and ethnicity. We know that it disproportionately impacts us, like hypertension. But there's been some reporting about hypertension that says there's some sensitivity to salt. That's part of the people of African descent. There's a salt sensitivity that could be leading to the high rates of hypertension in this country, and there also could be some stress levels as well as hypertension. We're not going to talk about that. That's on the mental health show. We're going to talk about that on the mental health show. But is there something like a physical tie, the reason why more people of African and Caribbean descent tend to get glaucoma, or is that just kind of one of those factors that happens?
Well, we do have a higher likelihood of having the thinner cornea, so the
Okay.
anatomy is different in patients of color. Um, in terms of stress, cortisol levels, that's associated with steroids, and that
Mhm.
change the outflow of your eye. So chronic stress, chronic steroid exposure can over time change the actual drainage system of your eye, can clog it up. So the pressure starts to increase over time.
Okay.
Right. And I mean, I think we can't ignore our history, although in a lot of, you know, forums, it's glossed over. But our treatment in America, because in my opinion, race doesn't really exist scientifically, but it's developed over time to create a hierarchy. It controls access to care. It controls some of the things that we've been through, like Dr. Brown alluded to, trauma that gives cortisol increases in our general body and health of our body. So most of these conditions that have to do with environment, that has to do with diet, that has to do with a historical adaptation to poor conditions are going to affect us more because our ancestors went through something very real, something that changed a lot of our psyche, that changed a lot of our body and how we react to certain things, including salt, like you're saying.
Mhm.
But some of these things can be overcome just like they were created. They can be overcome with time, good access, and good habits. So
Right.
I think we start now, especially the people who have the access and the resources, and you just try to make each generation do better.
And I see a lot of patients that aren't diagnosed.
Yeah.
So they'll see somebody who may not have looked at the nerve, may not have told them that they're at risk for glaucoma. There are a lot of gaps in care. And I think one of the things about, physicians of color, Black doctors, is that we're gonna look for that. We're gonna think about that. That's gonna be in our differential
Right.
because it affects our family members. It affects our
Mhm.
community. So there's a different sensitivity to treating and diagnosing glaucoma when you have a different perspective and a different history that you come from. If that makes sense.
No,
And
it makes perfect sense.
just to say it in a way that nobody can deny they didn't hear what I just said. If you have a family history of glaucoma or somebody in your family went blind from glaucoma, even if it's not your immediate family member, you should probably see a glaucoma specialist at some point in your life. As the earlier, the better, just to get a baseline exam, because we love our ophthalmologist colleagues, we love our optometrist colleagues, but not everybody examines the optic nerve as closely as a glaucoma specialist might. We know exactly what we're looking for. And there's a lot of specialties in ophthalmology, and there's a reason. It's because we focus on certain parts. I mean, we do our best to get the whole picture and send you to the appropriate specialist. But if you know you have a family history or you have some of these risk factors we've mentioned, you need to seek out a glaucoma specialist.
And just to kind of let people know, and y'all correct me if I'm wrong on this, there are 9 different specialties about the eye. Okay, 9. All right. So, there's retina specialist, there's there's retinopathy specialist, there's glaucoma specialist. So
And
make sure
every
you get.
specialty has a different personality too.
Right, right. We're the cool kids. We're the cool kids.
We're the nice guys.
But
We've got
I
a
think
good.
I think it's different also because in ophthalmology, we're the ones that really treat chronic disease.
Yeah.
So a lot of other fields, they kind of see you and you go. They see you and you go, but we treat families.
Right. We become part of the family.
Oh, okay, yeah. They bring us food, tomatoes, eggs,
chickens, right?
Well,
it's a real partnership. That's our goal as glaucoma specialists, is to create a partnership between the patient and us. We know that a lot of this treatment is lifelong, and we do our best to decrease the burden on the person, but we know that this is going to be a long-term relationship. In fact, if a patient is sent to us from another specialist, we pretty much know that that's now our patient for life. Right. Because that means that they've hit a wall, or they've gotten to a point where they can't do much more for that patient. And so now it's up to us to figure out what's next. And we don't have the luxury necessarily of handing that ball off again. So like Nanita said, we end up at people's weddings sometimes. We end up, people call, oh, that's my son too. We become part of your family. It's a real partnership.
Well, if you're saving somebody's sight, I think they're gonna have a full affection towards you. We've got a good question coming in from the audience. I'm gonna put it on screen here. What if there's no family history of glaucoma? At what age should screening be done? Assuming the person is of African-American descent. I'm just going to judge by the picture that this person is of African descent. So when should we start screening if there's no family history?
Yeah, that's a great question. Honestly, I think you should start getting a thorough eye exam in your 40s. If you're African-American, Latinx, or Caribbean American. If you have no family history and you're Caucasian, most of our screening starts for them around 60s or 65. But African Americans, because of that increased risk, you should start getting screened in your 40s.
Yeah, I agree.
So, Dr. Brown, I know I probably can guess what the answer to this question is, but I'm going to ask it anyway. Is there a cure for glaucoma?
There is no cure for glaucoma.
So
we haven't gotten there yet. Let me say, right?
I'm sure there's somebody working on it. I'm sure there's somebody in a research lab working on it.
My patients are always asking me about, eye transplants and nerve transplants, but we just haven't gotten to the point where we can regenerate the nerve tissue. And at some point, we will be able to regenerate nerve tissue. It's just like how we're able to do transplants on all different parts of the body. We just haven't been able to get to the brain and the nervous system. But at some point, we will.
So there are certain types of glaucoma that we haven't spoken about that you can treat definitively. Mainly what I'm alluding to is angle closure glaucoma. So in your eye, you have drainage system, and the most common form of glaucoma that African Americans and Caribbean Americans experience is an open angle glaucoma. This is not treatable with that laser that I was referring to. But if you have a narrow angle where the fluid cannot get out, and that's more common in Asian Americans and Native Americans, Alaskan Americans, you can do a laser that can open up the drainage angle, or you can even do cataract surgery sometimes to give more space in the eye. And that is an effective solution to open up that drainage system. That doesn't mean that they won't also develop open angle glaucoma, but if acute angle closure is their only issue, laser peripheral iridotomy is what it's called, or iridectomy can sometimes fix that issue.
Okay, so how many types of glaucoma are there?
Lots. That's why we did a fellowship. You can learn all the treatments and Yeah, there's a lot. There's congenital glaucoma, juvenile glaucoma, pigmentary glaucoma, pseudoexfoliation. I mean, there's a lot.
Yeah, it's an endless list. But even with all of those types of glaucoma, usually you kind of break it down into open angle or closed angle glaucoma, because that's sort of where you start your ideas of what type of treatments need to be done.
Okay. So speaking of treatments, what are the treatments for glaucoma? You talked about that fancy ectomy word that you were just talking about in terms of surgery.
Right.
So what are some other treatments for glaucoma?
So I kind of break it into 3 different levels of treatment. We start with medications. So there's a variety of eye drops. There's also pills that people can take if the eye drops don't work. The next level of treatment would be lasers. So if you didn't like the eye drops, you don't want to take the eye drops, you're allergic to the eye drops, we usually will move to laser treatment. And in ophthalmology, there's 15 different kinds of lasers. So this is a specific laser for glaucoma. It's very different from like LASIK or retina lasers. This is a laser trying to lower the eye pressure. So it's not going to help your vision. It's just a laser for your eye pressure. And then the highest level is glaucoma surgery. And we have surgeries that we can do when we do cataract surgery, and we have tubes that we can put in the eye to help drain the eye to keep the pressure down. We can make, it's called a trabeculectomy. It's like a little trap door that we can make in the eye. It's very, very eloquent, like all these different surgeries. But it kind of, the 3 basic treatments are medications, lasers, and then surgery where you have to go into the operating.
All right.
Okay. How do you
And with all of this said, let's always add the underlying element of healthy living. You should live healthy, don't smoke, moderate exercise. One of the weirder things that I don't know if it would ever come up if I didn't bring it up, but if you have an advanced history of glaucoma, wind instruments or tight neckties or inverted yoga poses or exercises can also make your glaucoma progressive. So these are lifestyle choices that a lot of people will never even think about, but they're important when you have glaucoma.
There's some patients that always sleep on the same side, so they increase their pressure in that eye, and the glaucoma can be worse if you're a side sleeper and you're always on that same side.
Yeah, or some people even sleep on their fists sometimes by mistake, not realizing it. And that is seriously, that's increasing their risk of glaucoma.
Wow. Okay. So you said yoga, wind instruments, and I'm
tight
not worried
neckties, tight neckties. So a lot of glaucoma specialists don't wear neckties. We live by example.
I don't think there's going to be too many folks, after the being home and working from home. And I think neckties are the way of the past. Maybe like weddings and funerals. That's it. You're going to see with neckties. After that, yeah, yoga.
I mean, it has to be sufficiently tight too. It has to be that kind that like you can see the person's veins popping out.
I mean, the other thing is also if you have chronic sleep apnea. So if you're falling asleep and not breathing, if you're a heavy snorer, those kind of things can increase your eye pressure.
Yeah, because I've learned that sleep apnea has a connection to the cardiovascular system, which of course we talked about the vascular system being important for the eye and that pressure. So that's how everything's connected. So if you think you're just a snorer, that could lead to exacerbating or a jump and start, kickstarting a glaucoma episode as well. So you're talking about just that mask that they give for people that with sleep apnea or are doing a sleep study. It's very, very important to get that done because that could have an impact on your vision as well as your heart. So you got to make sure that all of that's taken care of. And it's kind of funny because the next program this evening is going to be about sleep and all the sleep disorders. So that's kind of a nice precursor to our next show this evening.
There are studies actually that are coming out where they think that deep sleep, like REM sleep, where your eyes are moving while you're sleeping, is
Right.
actually how the lymphatics clean around your eyes. So if you're not able to get to that REM deep sleep, you're not able to clean the lymphatics around your eyes, and it might play into early aging and glaucoma. So there's a lot going on when you're sleeping that's healing you. And so
That's-
people that aren't able to rest and get deep sleep, it's extremely important.
Yeah, some of that is the best medicine, sleep. Just a quick anecdote. When I was in my training, one of our patients was a professional trumpet player, and he literally had 99% optic nerve damage, and he
Mm.
had to make a choice between continuing his career or trying to keep what little vision he had left, because he hadn't realized that he was essentially destroying his optic nerve by increasing the pressure in his intracranial pressure, his eye pressure, as he was blowing the trumpet so hard.
Mm.
Yeah, it was a devastating choice, and again, it just harkens back to the idea of being screened early. The earlier, the better.
So it sounds like even if you're, and Patrick had a good question from the audience, because like I think everybody's getting freaked out just a little bit. So they said, what's the best way to sleep if you have glaucoma? Should you just sleep on your back with the ice pack? Like what should you do? What's the best way to sleep
Oh
if you have
boy.
glaucoma?
No, I think you're fine just as long as you're getting rest. I think, we see the extremes sometimes.
Right.
So, the dramatics of the extremes. But for most people walking around, they're not going to have these problems. You can go ahead and do your yoga. The biggest issue is that if you have these risk factors, then you can just be aware and knowledgeable and kind of, act accordingly. Um, but if you don't have glaucoma or you're not at high risk for glaucoma, then you can function, normally. But there are a lot of anecdotes. There's a lot of things that we see because we see the extremes.
Right. And just to kind of make that point a little more concrete, the majority of people are going to do fine no matter what they do. But the problem is that special subset of people that are glaucoma suspects and beyond, those are the ones that have to change their lifestyle in some cases just to decrease their risks.
Right.
So the only way you can know, unfortunately, if you're in that subset is to be screened. It's not something you're going to feel. It's not something you're going to just be able to tell just walking around and doing a cover test per se. It really requires the examination or the screening of a professional.
So question, if one, can you have glaucoma in just one eye, or is it a pair? So you can have just in one eye. And why is it important, even if you're not experiencing vision loss, to continue to take your medication if you're on that first level that you talked about, Dr. Brown?
So I would say one of the problems that we see is when people come off medications, they get a flux in their pressure. And so that flux is actually what the nerve can respond to. So non-compliance gives you those fluxes in the pressure, and the nerve doesn't respond well to that. It will get more and more damage if you're coming on and off of your medication. So a lot of times, like Benjil's mom will do a laser, because then we know this person has like a baseline new low to their pressure. And hopefully that'll be able to kind of sustain and hold the pressure down, even if we have to add medications later. So it's so important if you start treatment to stay on treatment and to be followed. I usually see patients every 3 to 6 months, depending on how bad their glaucoma is. So you shouldn't be under somebody's care and they tell you that you have glaucoma and then you can come back, a year or 2 years. You should be seen regularly and be getting testing. So we have a lot of different tests that we do to figure out if you have glaucoma, to figure out how bad it is. And so you need to be getting these regular tests and exams.
Yeah. And I think one of the overlying the overlying message here is that in most cases glaucoma is treatable, but it is a patient-driven condition because we literally are just getting snapshots when you come into the office. When we see you once every few months, the pressure that you have in the office may be good because that person used their drops the night before or that morning. But if they're not using it the rest of the time when they're home, then they're not really treating their condition. They're literally hurting themselves. I have a lot of patients also. I won't say a lot, but there's that occasional patient that stopped their drops because they ran out. And they said, I was just waiting until I came back to see you to get the refill. But, life is such that we don't know when things can, when an appointment can get canceled. And I mean, let's be honest, even worse, when something can shut down the country, like just happened not too long ago. Like this, we can always call in your refills. Doctors and offices never want you to be without your medication. If you're running low, you should just contact us. There's multiple ways to contact your doctor's office now, which include texting or computer applications or calling, or even showing up one day and just leaving a verbal message, and we'll immediately send your medication refill. We genuinely want you to be treated at all times. And if the drops don't work for you, sometimes you are somebody that requires surgery, and sometimes that might be the answer. And surgery is not always a bad thing or always a scary thing. Sometimes it's the right thing.
And just to kind of put a little connotation on the surgery, most of these surgeries don't take more than about half an hour, 45 minutes. So we're not talking about surgery where you're spending the whole day in the operating room and it's very dramatic. Ophthalmology surgery, like cataract surgery, 5 to 10 minutes. Most of these surgeries are outpatient. You need to have somebody with you during the day. Like Dr. Edgehill and I, we go to Haiti. We do cataract surgery all day, glaucoma surgeries all day. Like this is our bread and butter. Like this is what we do, and we do it well.
Yeah.
So what if you're in a situation where you're on a fixed income, you're getting glaucoma medication. What if you can't afford to pay for? I mean, I know all these different plans is like as many plans as there are types of glaucoma. Probably it's probably the way the list is. But what happens if you can't afford the medication?
Yeah, actually, there are quite a few resources, and this is a great segue. I'd love to thank Prevent Blindness for introducing me to this program. And also, they have a program called the Glaucoma Community, which you can get as an app on your phone or through your web browser. And it's basically a resource for patients that empowers them, it educates them, it connects them to other people suffering with glaucoma, where they can feel a true sense of community and share stories. And also, Prevent Blindness has resources that links to ways to afford your medication, because some of these glaucoma companies actually do have programs where they'll help you afford a more expensive medication, or they'll give you samples. But the honest truth is sometimes with insurance, it can be difficult. And if it is too expensive, which does happen here and there, we, as your physician in a partnership, have to figure out a different medication for you. We have to figure out whether now it's time to consider surgical intervention, because maybe you'll require fewer drops on the other end of that surgery, or laser as well. I tend to do the laser light rejuvenation treatment earlier in the disease process, but it can also be done later, and that in many cases will help people to decrease the amount of drop burden that they have to tolerate each day or go through each day.
The other key important thing to also realize is that if you are getting ready to have cataract surgery, somebody's about to go in your eye for cataract surgery and you have glaucoma, we have glaucoma procedures that we can do at the time of cataract surgery. We can put in drains, we can put in stents, we can open up the drain. All of these exciting technologies are coming out in glaucoma. You know, glaucoma is sexy now. Like, we have a lot going on and a lot of new things that we can do that we couldn't do before. So that's why it's important to have a surgeon who has exposure to these different types of surgery and is good at them.
Yeah.
All right, so I'm gonna ask the question. I know y'all knew it was coming. Cannabis and glaucoma.
I didn't know that was coming.
I didn't know it was coming. That's a popular question when it comes to glaucoma. Can somebody use cannabis as a way to alleviate the pressure on the optic nerve?
So the eye pressure does go down with the use of cannabis. The problem is that it only lasts for a couple hours. And so the medications that we use now are, you only have to use them once a day, maybe twice a day, versus if you were to use cannabis, you would have to constantly redose all through the night. Some people don't have a problem with that, but
right. Some people are doing that already.
I'm not really an argument against it, but it hasn't really been made into something where people can use it and be able to function and not have to be constantly redosing.
Right.
Yeah. And I mean, just imagine you would literally have to be pretty high 24 hours a day, 7 days a week to be treating your glaucoma effectively. And with that said, there is research being done on, cannabinoids, some of the properties to see if it can be turned into an effective treatment. But as of yet, there is nothing that indicates that it would effectively treat glaucoma.
All right, y'all. So tell y'all uncle, tell y'all cousin, they're not treating that glaucoma
No.
when they're standing outside. They're not treating. Just for that moment, they feel like they're treating it, but it's not. Okay. Go see one of these doctors, go see an ophthalmologist, a glaucoma specialist, get some real medication, and then use that recreationally if that's what you choose to do. But you're not helping your glaucoma.
We're not there yet. We're not there yet.
Yeah. And please don't use it as a substitute for your real glaucoma drops or medication.
Please.
It's like, it's all right. I smoked, so I'm good. I don't have to get the drop in today. No, don't do that.
Please don't. Follow your doctor's recommendation. There was a question about somebody was asking, like they don't have a family history, but they were trying to find a glaucoma specialist or ophthalmologist in the Detroit area. So we do have resources on blackdoctor.org. On our website, you can there's a find a doctor page, and you can put in the specialty or you can put in the area. And we're looking to make some improvements on that page, but we have quite a few doctors on that page. And so put your area in and see if we can find an ophthalmologist for you. And then there's a number of resources, National Eye Institute, Prevent Blindness. They have a number of resources available and doctors in there. And then also the NMA, National Medical Association, has a number, and that is the Black Medical Association. So they will be able to connect you with a doctor of color to find. And hopefully in Detroit, there probably should be a doctor of color in Detroit now.
Yeah, I would say also any university that has a large medical center will have glaucoma specialists, especially if they train ophthalmologists, they'll have a glaucoma specialist. We also have the Black Eye Care Perspective, There's a search engine on there to find Black doctors. So there are a lot of resources. So you shouldn't have to go far to find the care that you need. We're trying to make it more accessible.
Yeah, it's as simple as typing in your phone glaucoma specialist in Detroit or wherever you are. And I mean, we have the most powerful computer right in the palm of our hands now. Find just about anything.
So I'm going to put another site up, and I'll put this in. I've been putting some resources. There's a short YouTube video. It's animated, so it's very, very good. It's from the NEI. That's the National Eye Institute. So if you want to go to their website and get more resources, that's nei.nih.gov. I'll put that on screen because that's a lot of dots and a lot of N's. But it's the National Eye Institute at the National Institute of Health.gov. Always go to preventblindness.org. They have a wealth of resources and things that you can download, and connections. They talk about financial assistance. I put that in the comments as well. So if you need financial assistance for anything, they can help you with that. So we're going to eliminate the excuses for you not to have your glaucoma treated. So what have we learned this evening as we're coming close to the end of our hour? What have we learned this evening?
Can I say one last? So even on Prevent Blindness, they have a glaucoma educator portal, and it's a free course you can download, and it's a very good course teaching people how to be their own eye advocate or their family's eye advocate when it comes to glaucoma. And one thing I didn't want to neglect to say is the caretakers. There's always that person that brings the person into the office. They do all the legwork, but they never get themselves checked. That's the person that we want to get in that chair too. Don't be the one that saves everybody else and forgets about yourself.
That is an excellent point, because you're right. The caretakers beat themselves down and because they're taking care of everybody else and not to themselves. And we always say here, you cannot pour from an empty cup. So if you want to caretake people, take care of yours so you can give the energy once you're stable to those people that you're taking care of. So number one, we have learned so much tonight. There are a number of types of glaucoma. That's why you have to go to a glaucoma specialist. We've learned that glaucoma specialists in the ophthalmology community, they're the fun ones. All right. So we learned that as well as tonight too. We also learned. We also learned that if you are African American, Caribbean descent, or Hispanic, Latinx descent, origin, ethnicity, then you are in a higher risk category. So you probably should, and especially if you have a family history, that increases the risk. If you're engaging in risky behaviors like smoking, steroid use, a lot of steroid use, that is going to increase your risk of glaucoma. So you start getting screened, even if you don't have a family history. You should start getting screened as an African American. You start getting screened, let's just say at 40. Let's just make it even at age 40. And you should see an ophthalmologist, get a screening. If you come back clear, if you have a clear, you should see that once a year, right? You should see your ophthalmologist once a year. And that is a full dilated screening, not what you see at the optometrist for glasses. That's a whole separate screening. And go get that too. Because if you have some problems reading, we could talk about the 20-20-20 rule. That's keep your eyes. But you need to get the full dilated with an ophthalmologist to get that full diagnosis, particularly if you're talking about glaucoma. And one thing we didn't talk about tonight, everybody gets cataracts. So you can't escape cataracts. That's just one of those things. As your eyes age, as we're getting older, as Dr. Edgehill talked about earlier, as we continue to get older, guess what? Our eyes get older with us, and you're going to develop cataracts, right? So just what it is. So
and some of our best treatments for glaucoma now involve cataract surgery. So we can help you see better and help your pressure as well.
Well, that sounds like a 2-for-1, right? So you might develop a coupon for that. So all jokes aside, this has been a fantastic discussion. As you can see, we had the best and the brightest here. I want to thank our partners at the Children's Vision Equity Alliance. We didn't even mention them: CBEA, Dr. Mary, she's just been a godsend in terms of putting together the Seeing Eye to Eye programs each month, and the National Eye Institute. Everybody over there. Are we pumping a book? Are we pushing a book?
We just got a book. He got a book. We got a promo.
The Glaucoma Guidebook. Okay, is this your book?
This is Dr. Constant Okeke. She just released this book. She's
Black ophthalmologist.
It's an excellent book. I just want to.
For patient education.
You didn't ask me to do that. I just think it's an excellent book for patients and physicians and educators.
No, I think that's fantastic. So go ahead. If you're in one of those risk groups, high risk groups, you're older, African American, and you want to learn about glaucoma, the Glaucoma Guidebook is written by a person of color, so they're going to have that baked in there. And then we talked about that earlier this evening. There's a cultural competence that we're going to work on. And they get some of their patients. They talked about it tonight. They get some of their patients from people that didn't even screen for glaucoma, somebody that has a risk factor. So I'm not saying that all doctors of color, ophthalmologists are not good and don't have that competency, but just that's why we have these programs. So when you go to see your ophthalmologist, say, hey, doc, should I be screened? I'm 45. Should I be screened for glaucoma? Can we do a screening for glaucoma if they don't do it, automatically? So just way to advocate for yourself. And I'm a big, big proponent of that. You cannot wait for all your doctors they can't think of everything. Be an advocate for yourself, because you are with yourself every single day. You know what's going on with your body, and you are the best reporter of your body. So please, please, please advocate for yourself. Or add your eye appointment, right? I know we go see our primary care physician. We do our annual checkup, but there are some other doctors you need to see. And that is an ophthalmologist annually and a dermatologist annually. And that's for people of color specifically. Add those two doctors to your regimen in terms of when you're setting your appointments, and a dentist. I'm sorry, I forgot that too. Go see your dentist.
Yeah.
gotta go see the dentist. So that's 4: primary care physician, ophthalmologist, dermatologist, dentist. You see those 4, if you do what you're doing between those visits, you have a clean bill of health, and you can live that long life that Dr. Edgehill was talking about early on. And all you have to worry about is cataracts, and then we'll deal with that when it happens.
That's easy. That's easy.
As a kid say, that's light work. So I will say thank you both for joining us this evening. This has been a fantastic program. Thank you for sharing such great information. Guys, go see an ophthalmologist. If you don't take anything from this program, go make an appointment, get screened, and get a clean bill of health. Don't be afraid for what can happen, because even if they tell you something's wrong, if they tell you something's of concern, at least you know, and now you can start treatment versus letting it linger and linger and linger till it gets to the point of no return. And then the longer you wait, the less they can do to help save your vision. So get in there early, get checked, and get moving. Okay.
Yeah. Download the Glaucoma Community app. It's great information for everyone.
You got apps for everything else. Go and get that Glaucoma Community app. Okay.
Amen.
You can delete some of them other ones you got on your phone. How about that? This is great. Y'all have a great evening. We'll see y'all next time.
Thanks
so much.